Hi everyone! So today we're going to be talking about lymphedema. I made a brochure for you to look over while I give my presentation, but since we're not in person, I just screenshotted pictures of that brochure, inserted it into my presentation, and we can look over it as I go. So this is the brochure. We're going to be talking about all aspects of lymphedema, what it is, how it happens, what are some signs and symptoms, what I should look for, how do I get diagnosed, how can I manage it, and what the importance of physical therapy is. So, what is lymphedema? Lymphedema is low-flow edema that is caused by a compressed or inadequate lymphatic transport system. There are primary and secondary lymphedema, primary being idiopathic, we don't know the cause, secondary being acquired, usually from surgery or dissection of that lymph vessel or duct. There's 4 stages also. How does it work? So your lymphatic system is impaired one way or another, which causes proteins and lipids to leak out and accumulate in the interstitial fluid. This disrupts the tissue, increases the pressure in that area, increases adipose tissue deposition and fibrosis. So what should I look out for? What are some signs and symptoms of lymphedema? Early signs and symptoms include numbness, burning, aching, pain, skin tightness, limb weakness, decreased range of motion, difficulty making a fist. Rings and watches may feel tight as well. Pitting edema occurs in stage 1, which is the feeling of tightness or swelling limb. If you put your finger to your skin, press down and press back, you should see your skin bounce back. If it doesn't, if there's that indent in there, then that is pitting edema. So some late signs and symptoms include increased limb girth, postural changes, increased discomfort, increased numbness and tingling, and skin changes. So how do I know for sure? How can I get diagnosed? MRI, CT, and X-ray, they can all take a deeper look into your tissues, see if there's any fluid that has leaked out into them, which shows that is a sign of lymphedema. Lymphosonography, which is the use of nuclear medicine to see lymph vessels and nodes and their flow. This can be used to detect abnormalities. Unfortunately, there's no clear-cut answer or criteria for diagnosing lymphedema. A physical exam and thorough history of symptoms are key to a diagnosis. How can I manage my lymphedema? So medications have a weak evidence base. There are some medications that can be beneficial, including ketoprofen and other medications that lyse proteins for easy reabsorption into the system. Medications to avoid include neuropathy medications, diuretics, NSAIDs. They can all worsen lymphedema. Surgical procedures are also an option. These include rerouting the lymph flow by grafting or the debulking procedure, which can be done at the last stage. So, importance of physical therapy. Why do I need physical therapy? You need the physical therapy to get a little bit more educated on lymphedema and learn what you personally can do to help minimize your symptoms. A physical therapist can also perform manual lymphatic therapy that promotes healthy lymph drainage. And a physical therapist can also get you an exercise plan that is custom for you. Learn exercises that are safe and beneficial for you. These all include, increasing your balance and balancing exercises, range of motion exercises in your affected limb, and exercises that increase the flow of the lymphatic system. So thank you guys for listening. I hope you learned a little bit more about lymphedema. Visit your local physical therapist or PCP to learn more.